Well, welcome everyone. This is the end of detox session on Monday night. It's a series of several of us that are signed up with Rise Up Wellness through Heidi Laus. And we're just so excited that we can offer this to our clients and to our customers who are using Purium in the end of detox summer program. Some of you may be on a 90-day program. Some of you may be just starting. Some of you may be just doing a 30-day. We welcome all of you. And some of you may be seeing this on a YouTube class or on Heidi's feed. So welcome. My name is Julie Dow. I'm the speaker tonight, and I have my helper, Ilsa Greater X Duncan. She is actually my housemate, but we are not together right now. I am far away and she's back home. So I'm excited that I can do this and be far away and enjoy a little trip away from home because I get breaks every once in a while from my job. So a little bit about me. I'm Julie. I am a almost 60-year-old woman who has been in dentistry for almost 40 years. I'm a dental hygienist. I graduated from Cabrillo College. I've been in practice for like 39 of those 40 years because one year I took off to have a baby. She's now 29 years old. And so, yes, I have been serving my community here in Santa Cruz County, in Salinas, in Monterey, in San Jose, for most of that time in different dental offices. And what has me so fired up right now about my career is that it's at the end of my career. And it's the most potent part of my career because I'm actually doing something that's making a difference for my patients. I'm not just moving plaque around the mouth. Okay. So when I started dentistry, we called it plaque. And I mean, that's how far we've come. We now call it biofilm. That little filmy stuff that's on your teeth that I clean off is biofilm now. And sometimes I still call it plaque with my patients because, you know, I'm old school. I'm old school who has learned new tricks. So that's kind of a little bit about me. I got into dentistry. I thought it would be really an exciting career because I really enjoyed learning about my own health. Taking all the classes to get into dental hygiene was pretty strenuous. And in other words, I took microbiology, I took physiology, I took chemistry, I took nutrition, and we are expected as dental hygienists to have all these classes underneath our belt before we go on to take our state boards. So I am certified with the state of California, and we take continuing education courses every 2 years. We have to have a maximum of 25 units every 2 years. And I have been doing that for almost 40 years now. I took it on myself to dive deeper into my health because even as COVID was approaching, before we even know that was happening, I was feeling sick for myself. I was not feeling well. I was post-menopause. I was gaining weight. I was bloated. I didn't understand really what was going on. And I went into integrative health to give me some support. And I started an elimination food diet. And at that gave me some support. And you guys are nodding your head. You've been there before. You start eliminating food, you start changing it up. I started going into more of like a keto, paleo, Whole30 type situation. And it was helping, but it didn't quite help me past a really stressful time when COVID hit. When COVID hit, I was supposed to be on a trip to Europe for 4 months. And so I got really upset, really stressed out. I lost my job. I lost my trip. I was stuck at home with my partner. Hopefully, he'll never hear this, my ex partner. And I was like, I can't go to Europe. And this one night, I was watching TV and seeing all these Italian men who I was supposed to go meet, right? And they had bags over their head, and it was like my body just freaked out. It just literally freaked out. So the night I was supposed to go on a trip to Europe, literally I was supposed to be on a plane, I ended up in the hospital because my body was purging. I got so stressed out. I didn't even know what was going on. It just started purging. And I didn't know what to do for myself anymore. My partner didn't know what to do with me. I got on an ambulance. They checked me out. Nothing was wrong. But the next day, even though they did all these tests, I couldn't hold anything down and I was still nauseous. I signed up for coaching school that day and I started to learn more about digestion and what is best for us, how to have a great sense of mind even while you're eating, chewing your food 30 times before you swallow, things like this that I won't go into too much detail, but it gives you some idea of where I was at. And through the process of me going into this coaching program and still wondering what I'm going to do about dental hygiene, I managed to graduate from the coaching program and I went into transformational coaching as well, which is where I met Ilsa. And she, in her quest, found Heidi. Well, they've known each other for years, and Heidi was Imperium. Therefore, the lineage is Heidi, Ilsa, me. And now you, Ellie. Isn't that amazing? We have a lineage. It's amazing. And so through coaching and finding Ilsa and Ilsa going on her journey, sharing it with me, my health started to improve tremendously. In fact, when I went on the ULT, I lost 25 pounds. I kid you not. Within the first 2 weeks, it was 12 pounds. And I was like, oh, wow, what is going on? And then 2 weeks later, more weight came off. And I did get to go on that trip to Europe, which I went last summer for 3 weeks. And when I came back, I thought, oh God, I ate whatever I wanted over there. I came back, 5 more pounds were gone. I was like, this is amazing. This stuff is working for me, And I mean, I just had a good time when I was over there, but I did walk a lot. But here's the deal. I got myself healthy enough to take that trip, to deal with the stress of flying post-COVID, the deal with the stress of missing trains and planes and automobiles and all that stuff, and walking all over London, walking all over Paris. And I found my Airbnbs and I found my hotel, and I was like, I had it together. Thank God for the high vibration from these foods. That's what I got to say. So, a little bit of a story about me. Hence, I decided to change jobs and go into working for an integrative dentist. And that's where this is really going to get interesting, because I got to merge dentistry and my knowledge of all that I took from all those years of practice and my knowledge of coaching and of using superfoods into my practice now. Yay, it's so amazing. So when I talk to my patients about their health, I get to integrate the oral microbiome health with the gut health. It's so amazing. I love it. And most of the time, these patients that come to us are normal dental patients. They're coming in, but they've been on a journey with an integrative method of healing. A lot of them have been through gut issues. A lot of them have had issues with their joints, issues with autoimmune. So they're familiar with what's going on, but they still haven't moved into the superfoods phase. If anybody here understands integrative medicine and integrative dentistry, they're the cutting edge of what's happening. And now we know that regenerative health is even more cutting edge. We're just like moving up the ladder there. So I'm kind of in that, weaving these two worlds together, teaching my patients about their oral microbiome, and also slowly integrating the Purium way and the Purium superfoods way. So that's kind of where I'm at. And so what I want to talk to you about today is what I do when I take a patient on a journey. If they haven't had their teeth cleaned in, say, 3-5 years, and they're noticing that they've got some sensitivity, or they're noticing that when they brush their teeth, their gums bleed, or what we notice when we're doing an assessment of their mouth is we notice that their gums are bleeding. We have a no bleeding policy in our practice because bleeding gums is inflammation. And if gums are bleeding, inflammation, what else do you think has inflammation? The gut. Yep. Your entire digestive system is at some form of inflammation. And some patients will report to me they have been struggling with IBS or SIBO or something like that for years, and their doctors are doing the best to help them. Hence, what we do is I'm going to start doing a screen share here. I'm going to show you a little bit about how we do a saliva test in our office. So we sign our patients up for gum therapy if we notice a certain degree of bleeding. And there's 3 different levels of gum therapy. There's normal gingivitis, there's more advanced gingivitis with some pocketing, and then there's advanced gingivitis, almost in periodontal disease, which is a big word, but that means that all of the structure around the tooth is diseased. And that could be involved a few teeth or most of the teeth. And that's more like the 3rd stage. Okay, you're following me? All right, so I'm going on a journey here with you of what I do with my patients here. Let's see here if I can get the share. All right, there we go. And I'm going to open up how we start a saliva test. Can you guys see the screen okay? Because I can't see you.
Yeah.
Awesome, thank you. Yes, we'll do that. So when I sign a patient up, so we're doing gum therapy. So with the gum therapy, we assess through doing a perio charting. You know, when a hygienist goes around each one of your teeth and calls out numbers,
Yeah.
3, 2, 2, 3. You want to hear 2 through 3. If you start hearing 3 and 4 and like 6 multiple times, then that means we're having some issues with your gums. And especially if you're hearing bleeding here, bleeding there, that means that there is more going on. And so I want to see a little, yeah, here's my sample. I'll let you take a look. So what I did, so in our office, so the practice has a program, gum therapy. We do some help inside the office. Literally, that's the cleaning of the teeth. And I use a special solution to clean around the gums. And I take the patient on a journey. The first thing they do is they take a saliva test. And when the saliva test comes back, this is what you get, this reading here. You guys see all this?
Yeah.
Lots of information. So we're going to learn about halitosis. We're going to learn about, and what I help patients do is I show them how to brush their tongue or use a tongue cleaner. Have you guys seen a tongue cleaner before?
Yeah, I use like the Ayurveda one, right? Like
Yeah,
the
that's a great one. The copper ones are the best.
Yeah.
We don't give out those because they're pretty expensive, but we give something that's really similar to that, and I show the patients how to use that. So that's going to help with halitosis, and because usually the type of bacteria that coat the tongue cause halitosis. Okay, so we're going to find out how we relate to most people who take this test. So it's what's really neat about these tests. And you can actually take, if you're curious about this and your dentist doesn't do this, hit me up, send me an email, and I will show you how to get this test on your own. You can buy it yourself. It'll go to your home and you can take a test by yourself. And I'll teach you how to do that. But we get to do it here in the office. And what's neat is you'll learn all these different things, what your gum inflammation score is, what your tooth decay score is. So there's many different types of bacteria, and some of the bacteria cause more tooth decay. Some of the bacteria cause more gum inflammation. And then check this out, gut impact. How about that? And then it explains, as you look at it, when you get your results back, it'll explain to you what happens. This is going on. And I will talk to this with my patients about what we can do about this. This is a really important one right here. This is commensals. This is something that I've never learned before with all that education I had. I learned this now from this company, Bristle Health. These commensals are the good microbiomes that are in the mouth. We have to have these in order to have a healthy microbiome. So if these are in the mouth, they're also in the gut. And we have discovered that and diversity, having lots of diversity is really important as well. And also nitrate reduction. In other words, What happens inside the mouth, if the mouth is open a lot, especially while we're sleeping, the mouth turns, the air turns all that nitrate reduction into nitric acid, and we want nitric acid. And guess what helps? Nitric acid. Can't beat this. All those super greens that they teach us in Purium help us. So this is a little bit about bristle health. So that's one of the tests I do. There's another test that we work on that is called direct diagnostics. And we test, same thing. It's a little bit of a different test, but it gives us a lot of information about the types of bacteria that can cause these things right here: heart disease, stroke, high risk pregnancy, Alzheimer's disease. Very, very important. So depending on how advanced this patient is, I will choose between one of these two tests. Okay, so they come in, they get their teeth cleaned, and I start moving out that biofilm. Because what happens is, if it's been a long time since you've cleaned your teeth, the biofilm forms this like protective coating around it, and then it hardens. You know what I'm talking about? That tartar that gets on your teeth.
Yeah.
You know that part? And it's like the hygienist clicks all that off. I click all that off, and then the bacteria now can't be in a little colony. It has to be out. So literally what happens is the bacteria produces the biofilm and lives in it. So that biofilm, this is like kind of what I like to tell patients. It's not my favorite thing, but it gives them a perspective. The bacteria is pooping on your teeth and then living in that biofilm. And that biofilm, if that bacteria is not a healthy bacteria, a good one for you, and it's proliferating, it's going to get in the rest of your system. And so what I teach now, I'm going to go back to share screen, is how to clean the teeth better at home. So I do the thing in the office, and I send them home with a package. I send them home. One of the main things we like to do is use an electronic brush. And my favorite electronic brush, if I can find it up here, is, I think this will do it. There we go, the Philips Sonicare. One of my favorite. And let's look at this pink one just because it's so pretty. And my patients will say, and look, it's $119. And believe me, something like this will last you a good 5 to 10 years. All you have to do is replace this little tip right here, the tip, just this part. Has anybody here ever used Sonicare?
I just got one like within the last year. Actually, when I started doing the protocols, and it wasn't related. I didn't know. I honestly didn't get the connection between teeth and gut health, but it makes perfect sense when you start to actually think about it.
Yeah.
I did it more because I have recession.
It's so helpful,
I
isn't it?
brush so hard. I'm a hard
Right.
brusher.
So I teach patients to use a light touch, just the weight of the brush, and go 30 seconds on each quadrant. So 1, 2, 3, 4 quadrants. And we also call it upper left, upper right, lower right. And so, and we also teach them to use a better type of toothpaste. We have them on a special dental side-in toothpaste, which actually I didn't bring that up because that's something that's like more tailored towards a specific need for each patient. But there are some amazing advanced toothpastes out there that you don't find in the store. But there is one that I did want to share with you. I'll do a share here. That I like, called Risewell, and it has hydroxyapatite, which is so amazing because hydroxyapatite is what our teeth are made of. So we can bypass the need for fluoride and use hydroxyapatite. And you can find this, hold on, I got to move stuff around. Find this online. It's called Risewell. Risewell is the name of the toothpaste. And I give samples of this out. And there's one sample that you would like here. I'll go this one because you said you have sensitivity. So there's the Risewell Pro that has nano hydroxyapatite in it. There it is, the mineral toothpaste. And Ilsa knows what Nano means, right? It's smaller particles and it
Yeah.
can get into the enamel much better and create an environment where the tooth enamel can take up this nano hydroxyapatite and start to strengthen it. And here's the
Okay.
big one right here, fluoride free. We also have discovered in dentistry through integrative dentistry that fluoride messes with the oral microbiome of the mouth. It's
Huh.
really a last
Like
resort.
it overkills it. It's like too,
Yes,
yeah.
yes. And so
I
what
was,
happens,
yeah,
ask questions, go ahead. I'd love to talk about this a lot.
that was fascinating. I'm, I don't know. I've been pro conspiracy theories for a long time and not really believing a lot of the mainstream, health stuff that's given to me, that because it doesn't work.
Well,
No real doctors actually helped me. I've
yeah,
had to figure it out on my own. So
right. Well,
I
there's a
didn't think
place
about the
for
fluoride, to be
fluoride.
honest. I
There's a
was
place
like,
for fluoride for patients.
yeah,
Here's the deal, because I've been using it my whole career, right? I haven't seen
yeah,
anything turn green and die on me.
yeah.
But the combination, everything else that's going on in our worlds, this is the last thing we need, right? And where fluoride is really helpful and supportive is when you start getting somebody who has rampant caries, say they have been in
Yeah.
a bad situation for a long time, they're finally able to, and you're just doing everything you can to stop this process of diseased teeth.
Yeah.
The time for fluoride. It's like a last resort. And
That's,
for
yeah.
people who just do not have access,
Hmm.
it can help. But it's not something that I would say I stopped using it regularly probably 25
Cool.
years ago. I would
Oh,
say.
wow.
Yeah.
Okay.
And I just use toothpaste that has more
Wow.
hydroxyapatite or it has more calcium in it. And I've been able to find it through natural health food stores. So, and I've, have my kids go on it. And I mean, it first started with Tom's. I mean, you see people in all different stages. They'll go to Tom's or they'll try something else from other locations. But this is just a toothpaste that we happen to use in our practice that I thought I'd share with you. Something I've seen everybody use. I use it. I like it. doTERRA has a good hydroxyapatite toothpaste. Some people don't like that it has erythritol in it. Just be careful. Some people are sensitive to certain sugars, some people aren't. doTERRA doesn't have any erythritol in it or any sorbitol. It only has stevia. That's why I like it. But I have used both. So that's just another way of supporting your dental health right there. Another really important way, I'm going to go back to share a screen. And another important aspect to helping your dental care is, wait a minute, what happened here?
I don't know, but that looks cool wherever you went.
I thought I did share. Okay, let me go back to Zoom here. End of summer detox. I don't know what happened. Woo! Hi, you guys. So nice to see you. Share. You are sharing a screen. I'm looking for. Oh,
Yeah, I feel like you maybe hit what, yeah, there you
there we
go.
go. Sorry, this is kind of new to me too. You guys are really bearing with me here. Water flossers.
Oh, what's wrong with real floss?
Well, floss is great, and we like to use cocoa floss, but these portable water flossers are the bomb. They change the game for everybody. And I really like, you can use a portable water flosser. Where's Waterpick? Here's the Waterpick one, cordless Waterpick. The reason why these are so great is because it's literally a pump pumping water, just like what I use in the dental office. In other
Yeah.
words, I use an ultrasonic device that pumps the water out and it breaks up that biofilm. And
Uh,
if you do this constantly every day, you're just eliminating the numbers of biofilm in between your teeth. So that biofilm cannot grow. And you'd be surprised how much food and how much debris comes out of your mouth when you use something like this. It's amazing. It's amazing. It just blows me away. And it's super effective. It only takes like 2-3 minutes. And this is something that I work really hard with my patients on as well, teaching them how to use these. So, yeah, I'm going to stop the share and come back to you. So then I send them on their merry way, and with this nice little kit, we usually give them a water pick, the tongue cleaner, the products, dental side and toothpaste and dental side and mouthwash. Oh, there's one other product I want to show you, but I'll tell you about it. And
Mhm.
then the cocoa floss. There's another product that I really like. If you're not ready to dive into all these fancy things that you can still find over the counter, it's called Closis, Clossys. Have you heard of that?
Yeah,
And-
I love their mouthwash. It's the
Yep,
only mouthwash I can use for
good.
my sensitive teeth. Yeah.
Yeah, what's great about that is it's chlorine dioxide, and so
Oh,
it's not harmful. And what we recommend is that you use it for 2 full weeks and then go off of it for 2 weeks and let your natural oral flora come back.
huh.
Yeah.
Okay.
And
Cool.
there's another product that
Like
Bristol,
2 weeks once I just use it at night. Was
yeah,
that
use it for 2 weeks and then give it a rest for 2 weeks. That's what's recommended so that the natural oral microbiome comes back. And then there's another product that we like to, where did it go? Why isn't it letting this up? Okay, what happened? Right here. That I forgot to bring up here. I think I can get it on the Bristle site. I think this is Bristle right here. Um, uh, Care plan right here that they have. The Bristle gives a lot of information and it has this right here, the Bristle Oral Health Probiotic. And for me, look, they want me to use an oral probiotic. They say this is going to be the most effective for you and super beats. Well, we discovered we don't like these super beats. We want to use can't beat this. What better way to get it and get started on a protocol of super beats or can't beat this, but with Purium. Purium has a great one. And I think I've compared the reason why we're not really too happy about this is it has some weird sugars in it. And it's about the same price as can't beat this. Check that out.
yeah.
So there you go. I'm going to stop share and answer questions.
That's yeah, it's so fascinating how it's connected also to your gut health. It's wild. So yeah.
And of
Like,
course,
I
I
just
like
learned a lot.
when we find out that patients have a certain bacteria, they get a choice of either going to antibiotics or doing a cleanse. And an antibiotics is faster and it's cheaper and 11 days and you can wipe out the bacteria. But if they're on the same type of lifestyle, it's going to come back. So if they go on a cleanse, then they're changing their lifestyle.
Yeah.
And my boss doesn't have time to really work with people on a cleanse because we know it's really hard to do. You got to change your lifestyle. So who better to help than a coach?
Yeah.
So I start coaching my patients. I give them my information. I give them options on what cleanse they'd like to do. But of course, I lean towards Purium. And this
Yeah.
is how I like to help my patients improve not only their oral health, but also their gut health. And so depending on these three different types of gum therapies that we do, that we have the patients come back every 3 months because it takes about that much time for the bacteria to start to really proliferate and grow that biofilm to where it's harder for them to remove with just natural brushing and water flossing and dental flossing. So having irregular visits is key. You know, having somebody to help you stay accountable. Are you brushing? Are you flossing? Are you using the beets? Are you using some zinc aid to help you with your oral microbiome? Because we want a healthier immune system to fight off these bacteria. So oral, a very healthy, strong immune system will also fight off these diseases as well.
Yeah.
Well, thank you all for being here. I'm going to take us off. I really appreciate you listening to my talk today. I'm going to stop recording now.